Recognizing the signs of heart disease is vitally important to save lives, but they're not all easy to spot. Here's Eyewitness News reporter Jeremy Baker in tonight's Wear the Gown.
When we talk about heart disease, many people think of conditions that come on suddenly, like heart attacks, stroke, or shortness of breath. If you have any of those, you need to be seen right away.
They end up coming to the hospital too late when they've already had damage to their heart, or in cases, let's say, of a stroke, they come in when they've already had damage to the brain.
Dr. Anand Prasad is an interventional cardiologist with University Health. He says a condition that is not as well known is called peripheral artery disease, or PAD.
Plaque buildup due to most often cholesterol-based plaque in the arteries. That can happen in any artery in the body. So that can happen in your heart arteries, your coronary arteries, and that causes heart attacks and chest pain.
That can happen in your heart, coronary arteries, arteries that go to the neck, arteries in your legs, and even in your arms. But a more extreme form of PAD that can present itself is called critical limb ischemia.
That is when there is such insufficient flow in the limb that you're at risk of losing the limb. And it's often related to ulcerations or wounds that can develop, particularly in people with diabetes.
There's a test. It's called the ankle brachial index. That's where you compare the blood pressure in your arms to the blood pressure in your legs.
If the pressure is lower in your legs than your arms, then you may have poor circulation or poor blood flow.
Dr. Prasad says those with heart disease are more likely to develop PAD, so you should talk to your doctor about how to lower your risk. Jeremy Baker, KENS 5 Eyewitness News.
For family health information, call 210-358-3045 or go to wearthegown.com. Alana?